So we're here to take a few minutes to talk to you about the health consequences of eating disorders. Eating disorders are serious, potentially life-threatening mental illnesses that affect both emotional and physical health.
Eating disorders are not just a fad or a phase. People don't just catch an eating disorder. They are real, complex, and devastating conditions that can have serious consequences for your health, productivity, and your relationships.
People struggling with an eating disorder need to seek professional help. The earlier they do, the greater the likelihood of recovery. So first we're going to talk about anorexia nervosa. Anorexia is the cycle of self-starvation where the body is not getting enough nutrients it needs to function normally. So then it is forced to slow down its processes to conserve energy, which can result in serious medical consequences. Some of these consequences are slow heart rate and low blood pressure. So the heart is changing, so then the risk for heart failure rises as the levels sink lower and lower. Reduction of bone density, osteoporosis, results in dry and brittle bones. Muscle loss and weakness. Severe dehydration, which can lead to kidney failure. Fainting, fatigue, and overall weakness. Dry hair and skin, as well as hair loss. And then the body grows a layer of downy hair called lanugo to cover the face and body to keep it warm. Amenorrhea, which is the loss of menstruation for more than 3 months, and most seriously death. Death from heart failure or kidney failure or suicide. Death rate for eating disorders is high. It's 18 to 20%. Eating disorders have the highest rate of death out of all mental illnesses.
The next eating disorder we're going to discuss is bulimia nervosa. Many of the health consequences of bulimia are unknown to most people. The recurrent binge and purge cycles of bulimia can affect the entire digestive system and can lead to electrolyte and chemical imbalances in the body that can affect the heart and other major organ functions. Some of the specific health consequences are electrolyte imbalances that can lead to irregular heartbeats and possibly heart failure or death. It results as dehydration and a loss of potassium, sodium, and chloride from the body as a result of purging behaviors. There's a huge potential for gastric rupture during periods of excessive binging. As well, inflammation and possible rupture of the esophagus from frequent vomiting. Laxative abuse can result in irregular bowel movements and constipation. In females with bulimia, it can also result in a loss of menstruation. Bulimia sometimes results in death, often from suicide, cardiovascular failure, and bloodstream infections.
So now we're going to talk about binge eating. Binge eating has results that are very similar to the same risk as clinical obesity, such as high blood pressure, high cholesterol levels, heart disease due to elevated triglyceride levels, type 2 diabetes mellitus, and gallbladder disease.
Treating eating disorders is very important. Research indicates that eating disorders are less likely to be treated than other psychological problems. These don't go away on their own, and they have serious health consequences. Can also lead to other psychological disorders such as depression, anxiety, and substance abuse, to name a few. It also isolates you from your friends and your family. If you suffer from an eating disorder, please seek help. Many of these health consequences can be reversed, and it is possible to recover and get your life and health back under your control.